What's going on, world? Welcome, welcome, welcome. Hey, y'all already know what the deal is. You already know what we're doing today. We are doing NCLEX questions both for RNs and LPNs. Hey, I know that I'm a little late, but that's okay. I'm a little late. Hey, better late than never, right? So shout out to everybody that is going to be here rocking with us. Hey, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Also, hey, I need 1,000 likes and I need 100 people. If I don't got 1,000 likes and if I don't got 100 people, I guess you're just going to have to go to somebody else for NCLEX questions, starting at 7 or 8 or whatever you want to do, you know what I'm saying? So, of course, make sure you guys smash that like button, you guys share, you guys follow. That is the trifecta that TikTok needs to get to the For You page. So I need to get in front of people that need this. What's up? How are you? Who is that? Is that is it Lantra? How are you? How are you? Hey, so a little bit about me. Been a nurse for 3.5 years, worked ICU, OR, PACU, was in the Navy for 16 years. And I failed my NCLEX 3 times, right? So shout out to all my people that were unsuccessful at their NCLEX, but never gave up and still got that license. And that's what I'm here for, y'all. Hey, I'm here to give y'all these questions some way, shape, or form, get into a routine so you guys can get your learn on. All right. But hey, keep smashing that like button. Make sure you guys keep sharing. Make sure you guys keep following. I need 1,000 likes, y'all. I need 1,000 likes. I need 100, and I need 100 folks. All right. What's up, Steffi? How are you? How are you? I know, Steph, I know you were I think you were kind of having a hard time last time we were in here. So, hey, hopefully you had a good weekend. Hopefully everybody had a really good and safe weekend. All right. But, hey, smash that like button, y'all. Share, follow, 1,000 likes. Get carpal tunnel. Get carpal tunnel for me, y'all. Hey, I got a good amount of questions over here. Good amount of questions. Hey, but of course, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what you doing here hanging out with us? What you doing here hanging out with us? What questions do we got? I was okay last week. Okay, cool. All right, cool. All right, I got you. Hey, because sometimes, I can pick up what y'all be putting down. Hey, we got 100 people up in here. Hey, make sure y'all smash that like button. We're 400 likes away from me turning this camera around so y'all can stop looking at this disgustingly hideous face so y'all can get some questions going on. You know what I'm saying? So, of course, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. And of course, like I said, if you're not a nurse, what are you doing here rocking with us? A lot of times I get PAs, we get medical students, pharmacists, you name it, different folks that be coming up in here, right? So what else are we thinking? Shout out to all 121 of y'all. By the way, I got these questions off nurseslabs.com. They are free sets of questions. So you guys can go over there and you guys can check those out for yourself. And if you're a nursing student and you haven't shared this to anybody that you're in like cahoots with or whatever the hell people use nowadays, you're wrong. And I'm going to need for you to fix yourself. So go ahead and do that. I don't care how you feel about them. I need them. I need them here. I need them here with me. You need them here with me. That's all I'm saying. So you already know how the deal is. We're going to do these NCLEX questions, but without further ado, here we go. Hey, question number 1. After cardiac surgery, a client's blood pressure measures 126/80 millimeters of mercury. Nurse Katrina determines that the mean arterial pressure is which of the following? Is it 46, 80, 95, or 90? What are we thinking? Where's the question? The question's right in front of you. What are we talking about? What are we talking about? Hey, appreciate everybody joining here. Hey, we're on the road to 10,000 likes. We're on the road to 10,000 likes. So make sure you guys smash that like button. You guys share, you guys follow. If we get to question 10, if I don't have 10,000 likes, all of a sudden my throat's going to hurt and I won't know how to talk. So I'm going to pull a Monique on y'all. Y'all better run me my likes. Here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is C. It is 95 millimeters of mercury. Using the following formula to calculate the MAP. All right, so it's the systolic plus 2 with the diastolic. Okay, so the 126 millimeters plus 2 times the 80, right, equals, what is that? 286 millimeters of mercury, which equals 95 millimeters of mercury. That is the reduction of risk potential, which is the fourth percent, which is the fourth largest section on the NCLEX at 9 to 15%. All right. So remember, hey, if you don't understand these aspects, you need to go back, look at content, keep doing your questions. Read your rationale. Your rationale is what will solidify all the information that you are learning from your content as well as from your questions. All right. So appreciate y'all. Here we go on to the next one. Question number 2. A female client arrives at the emergency department with chest and stomach pain and reports of black tarry stool for several months. Which of the following orders should the nurse Oliver anticipate? Is it A, cardiac monitor, oxygen, creatinine kinase, and lactate dehydrogenase levels? Is it a prothrombin time, partial prothrombin time, fibrinogen and fibrin split value, product value? Is it an electrocardiogram, CBC, test for octal blood, and comprehensive serum metabolic panel? Or is it an oh my God, I forgot how to say it. Whatever, bro. Y'all read it. That has to do with your liver function test too. So go ahead. Everybody's telling me C. Hey, by the way, there's going to be a lot of these things you're not going to say when you become a nurse, but whatever. Judge me all you want. But shout out to all 300 plus y'all. We're doing NCLEX questions. Got them off nurseslabs.com. They are free sets of questions. You got to go over there and check them out for yourself. Also, if you're a nursing student looking for something to help you with those case studies, Nurses Labs has those for you as well. But here we go, y'all. Here's our answer in 3, 2, and the answer is C. It's an electrocardiogram, complete blood count, testing for octal blood, and comprehensive serum metabolic panel. An electrocardiogram evaluates the complaints of chest pain. Laboratory tests determine anemia, and the stool test for octal blood determines blood in the stool. That is part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. The top 4 sections on NCLEX make up more than 50%. All right. It doesn't matter if you're it doesn't matter if you're an LPN or if you're an RN going for that. Okay. So just know that if you don't know that content, circle back, get the content, keep doing your Q&A, and then do those rationales. All right, here we go. Question number 3. Olivia had coronary artery bypass graft surgery 3 days ago. Which of the following conditions is suspected by the nurse when a decrease in platelet count from 230,000 to 5,000 is noted? All right. Is it pancytopenia? Is it idiopathic thrombocytopenia purpura? Is it disseminated intravascular coagulation? Or is it heparin-associated thrombosis and thrombocytopenia? What are we thinking? Shout out to all 259 of y'all. We're doing NCLEX questions. Hey, by the way, just letting you guys know, I don't know if you guys know who Nurse Glamour is. Nurse Glamour, Amber, she's an NCLEX strategist, as well as Nurse Larissa. We are going to be doing a collab on Thursday, this coming Thursday at 7 p.m. Eastern Standard Time. So we're all going to be on a chat together. So make sure you guys come through. Who just said they passed NCLEX? Julia from Florida just passed NCLEX today. Used you all last month. Appreciate you. Hey, everybody, hey, give Julia her flowers. Julia, congratulations. Welcome to the greatest shit show on earth, known as being a nurse. If there's one piece of advice that you could give to everybody, what would it be? And once again, congratulations on conquering that NCLEX. Shout out to you. All right, y'all, here we go. Here's our answer in 3, 2. And the answer is D. It's heparin-associated thrombosis and thrombocytopenia. May occur after a CABG surgery due to the heparin being used during the surgery. All right. Those two can fall under pharmacological and parenteral therapies, as well as physiological adaptation, which is number 2 and number 3, the second and third largest section on the NCLEX exam. Shout out to the UK. I found out I passed my NCLEX today. Shout out to you. Is it Callie? Shout out to you for passing your NCLEX. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give, ma'am, what would your advice be? It says, you're awesome. Thank you for helping us. Awesome. I love doing this. The NCLEX is super vague. Look for what's abnormal and how you as the nurse would treat it. Exactly. It's about good, safe, therapeutic answers, right? Clinical judgment, safe answers. All right. So shout out to you, Julia. All right. Here we go. Question number 4. Which of the following drugs would be ordered by the physician to improve the platelet count in a male with idiopathic thrombocytopenia purpura? Is it ASA, corticosteroids, methotrexate, or vitamin K? What are we thinking? What are we thinking? Hey, make sure you guys, if you guys are new here, make sure you guys smash that like button, you guys share, and you guys follow. It is a trifecta that gets this live out to the people who need it. All right, gets me in the For You page. I may not be for you, but I may be for someone else. Just saying. Also, if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. What are we thinking? Ashlyn, thank you for the follow. Appreciate you. Here we go. Here's our answer in 3, 2. And the answer is B, corticosteroids. Corticosteroid therapy can decrease antibody production and phagocytosis of the antibody-coated platelets, retaining more functioning platelets. That's part of pharmacological and parenteral therapies. All right. Pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 13 to 19%. All right. 13 to 19%. Shout out to the MIA. I see you, Miami. It says gone 3 times and I haven't been able to pass. That's okay. Hey, delayed, never denied. All right. Delayed, but never denied. All right. So pharmacology is a monster, ladies and gentlemen, and you need to know it. You need to know where it falls. You need to know how it affects the patient. You need to know what the pharmacokinetics, how it moves. You need to know how it affects the body, who gets it, who doesn't get it, when you hold it, when you give it, so on and so forth. All right. You got to know everything that you need to know about it. Ashley says, I'm a registered dietitian, but I love doing these to test my knowledge. Ashley, I love that for you. I love that you're here getting your learn on. All right. Here we go. Question number 5, a female client is scheduled to receive a heart valve replacement with a porcine valve. Which of the following types of transplants is this? Is it an allogenic, an autologous, a syngenic, or is it a xenogenic? What are we thinking? Graduate in August. That's what I'm talking about. Right around the corner. From the Philippines. That's what I'm talking about. Shout out to the Philippines. Shout out to all 400 plus y'all. Hey, a little bit about me. If you're new here, I've been a nurse for 3.5 years. I worked ICU, OR, and PACU. And I was also in the Navy for 16 years. I just recently got out in January. And I failed my NCLEX 3 times. And guess what? I don't care. I don't care what any of y'all got to say about that, because your opinion is irrelevant of me when it comes to me not quitting on what I wanted. I'm just saying. So I'm just letting y'all know. Don't let people write y'all's story for you. Never let someone write your story for you, ever. I don't give a shit how many times you got to take that exam or how many times you want to take it. Keep doing it. Keep doing it. Keep going. Hey, if y'all know my girl Amber, Nurse Glamour, look, she failed the exam multiple times too. And was she out here? She out here doing her thing. You know what I'm saying? Because who's going to teach us? Who's going to teach us? We got to teach each other. You're right. I passed, and that's the only thing. But you know what? Somebody always got something to say about a journey that don't got shit to do with them. You know what I'm saying? So don't let anybody dictate your journey, period. Amber, I see you, girl. I see you. And the answer is D, is xenogenic, right? A xenogenic transplant is between a human and another species. That's part of reduction of risk potential, which is 9 to 15% on the NCLEX exam, making it the 4th largest section on the NCLEX. Hey, management of care, farm, physiological adaptation, reduction of risk potential make up more than 50% of the NCLEX, all right? Just letting y'all know. Hey, it's better for you to know going into the exam what the enemy is like. The NCLEX is the enemy, all right? And know thy enemy, all right? Know thy enemy like you know when that new Starbucks drink is about to come out, or when a Kardashian fucking makeup line is about to come out. You better know thy enemy. You see what I'm saying? Hey, ladies and gentlemen, I got some test taking tips for you guys. You guys can go over there and check them out on my website. It's thebootnurse.com/test. Also, get a fanny pack. Get a fanny pack. Stop playing games, okay? Because I got one and I love it. But anyways, these are some test taking tips. Hey, 42 pages, y'all. 42 pages over there for y'all. So y'all go over there and y'all check that out for yourself. It's also linked in my bio. Can you repeat that? What is mainly on the NCLEX? All of it. I'll go back through it. You'll hear me. Somebody said something about, I was in the Navy. Somebody asked me, I passed my NCLEX. Who is I passed my NCLEX? I need a name. I need a name to go with that. Here we go. Question number 6. Marco falls off his bicycle and injures his ankle. Which of the following actions should the initial response to the injury in the extrinsic pathway? All right. Is it the release of calcium, release of tissue thromboplastin? Is it a conversion of factor, 11 to factor 11A? Or is it a conversion of factor 8 to factor 8A? What are we thinking? Shout out to all 350 of y'all out here rocking. We're doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. You can find questions all over the internet. You know what I'm saying? But remember, you need to understand what the NCLEX is asking you. The NCLEX wants you to use critical thinking in order for you to make a clinical judgment. All right. Clinical judgment. Clinical. Safe. Safe. That's what the NCLEX wants for you to do. All right. And if you can't perform at the basic level of safety, the NCLEX, you will not pass it. What's up, Aaron? How are you? All right, here we go, y'all. Here we go. Here's our answer in 3, 2. I got 100 on my NCLEX. That's not even fucking real. So, like, if you're trolling, boy, you lying like a motherfucker. But anyways, I love y'all. You know what I'm saying? But anyway, the answer is B, the release of tissue thromboplastin, right? Tissue thromboplastin is released when damaged tissue comes in contact with clotting factors. That is physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. 100% on the NCLEX is crazy. No, but shout out to you for passing your NCLEX. Who said they passed their NCLEX? They coming in here clowning. Is it Emil? Did I say that? Or Emil? Emil. So shout out to you, Emil, for passing your NCLEX. All right. So welcome to the greatest shit show on earth, known as being a nurse, my good sir. If there's a piece of advice that you could give to everybody for passing, for taking the exam, what advice would that be? And once again, sir, congratulations to you. All right. Hey, so remember, physiological adaptation. If you don't got content, you need to go circle back. Get your content, your Q&A, as well as getting your rationales, because rationales help you retain. All right. Rationales help you retain. Run. Hey, my man Jay. Shout out to my man Jay. If y'all don't know who Jay is, ICU nurse, he gonna be a CRNA soon. You know, out here putting folks to sleep. You know what I'm saying? UWorld is so hard compared to these. UWorld is definitely hard. ATI versus UWorld. I didn't like UWorld, and I've never used ATI, but I've heard terrible things about ATI. So it all just depends. All right, question number 7. Instructions for a client with lupus would include information about which of the following blood dyscrasias. Is it Dressler syndrome? Is it polycythemia, essential thrombocytopenia, or von Willebrand's disease? ATI is horrible. I bet it is. Hey, shout out to everybody out here rocking with me. All of a sudden, my voice is starting to kind of dwindle. I need 10,000 likes by the time I get to question 10. So, hey, at least you know you're getting 10 questions, right? I'm using Archer. As well. Like it a little bit more than UWorld. I personally like Archer more than UWorld. So ATI, no bueno for NCLEX, too many errors. Shout out, hey, Amber, let them know. Let them know about ATI. Same thing with HESI. I had HESI when I was in school. HESI is absolute trash. Hey, if you agree that HESI is trash, smash that like button. Let me know. All right, but here we go. Here's our answer in 3, 2. And the answer is C. It's essential thrombocytopenia. Essential thrombocytopenia is linked to immunologic disorders such as lupus and HIV. All right. That is part of Vanessa. Don't cry. Oh, my God. I passed that HESI exam. Hey, you better pass that HESI exam. So you guys recommend Archer? I think Archer is good. Hurst review, not a fan. I have what we call an environmental factor to Aunt Marlene and that country ass voice that she got. Shout out to her, but hers just didn't work for me. Physiological adaptation, 11 to 17%, third largest section on the NCLEX. I liked Kaplan. I actually used Kaplan and Kaplan was actually what helped me pass. But it doesn't matter, honestly. A lot of these reviews that are out there are really good. You just have to know how to apply it. And if you don't apply it the correct way, I could literally give you the answers and you would still get them wrong. So, and I only know this because I've done it before. Question number 8. The nurse is aware that the following symptom is most commonly an early indication of stage 1 Hodgkin's disease. Is it pericarditis, night sweats, what is it, splenomegaly, or persistent hypothermia? What are we thinking? We used Kaplan in 2000 and I passed the first time. Shout out to you. I didn't use Kaplan until it was my 4th time. So Kaplan is the OG of like all of the reviews, I think. Yeah, Kaplan is the OG. I think they've been around, I think like since the 70s or something, somewhere along those lines. I'm not sure. But what are we thinking, y'all? Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. They're free sets of questions. So make sure you guys smash that like button. You guys share and you guys follow. I use UWorld. Love it. Took my NCLEX this morning. Shout out to you, Kiki. Do you love me? All right, here we go. And the answer is B, night sweats. And stage 1, symptoms include a single enlarged lymph node, usually unexplained fever, night sweats, malaise, and generalized pruritus, right? So that is part of reduction of risk potential, which is 9 to 15% on the NCLEX exam, 4th largest section, all right? So make sure, it says this doesn't look that hard. Why Why do so many people fail? Well, so here's the thing. Since people come in here and they're just like, NCLEX isn't hard or these questions don't look hard, the NCLEX has like a test bank of like over 10,000 questions from everything from what is the correct blood pressure to, critical thinking type of case study questions. Now, the NCLEX can ask you any. Right? So a lot of people are looking at this like, oh, this is easy. But you got to remember here on TikTok, you got to meet people where they are. Some people here are just now learning. Some people have failed multiple times. If the NCLEX was that easy, it would be 100% pass rate, not 80 or not 79 like it was last year. Just saying. Here we go. Question number 9. Francis with leukemia has neutropenia. Which of the following functions must be frequently assessed? All right. So is it blood pressure, bowel sounds, heart sounds, or breath sounds? All right. And remember, on NCLEX, it's all about critical thinking. You have to be able to critically think in order to make a clinical judgment. It says use UWorld and Saunders NCLEX and over-prepared me in the best way, felt confident. Cool. Remember, there's so many different ways that people study. Like you can't put a book in front of me. You put a book in front of me, I'm going to fall asleep. So my learning techniques was auditory and visual, combination of like podcasts, good old Mark K, and looking at lecture videos. That worked for me. Other people, they can sit there and they can read a book. So here we go. Here's our answer in 3, 2, and the answer is D. It is breath sounds. Pneumonia, both viral and fungal, is a common cause of death in clients with neutropenia. So frequent assessment of respiratory rate and breath sounds is required. That is reduction of risk potential, which is 9 to 15% on the NCLEX exam, making it the 4th largest section on the NCLEX exam. It's kind of funny because I see a lot of people ask or say A, and it was definitely D. So I guess these questions aren't all that damn easy, huh? Y'all are funny. Here we go. On to the next one. Here we go. Question number 10. The nurse knows that neurologic complications of multiple myeloma usually involves which of the following body systems? All right. Is it brain, muscle spasms, renal dysfunction, or myocardial irritability? What are we thinking? Dang, I need to study. That's the thing about NCLEX. You need to cover all bases. Cover all bases. And remember, to RTFQ, all of a sudden, I can't talk. All right, RTFQ. And what are we thinking? All right, we got some A's, we got some B's. Now people are up in here and they're just like, man, I don't even know what to pick. RTFQ means to read the fucking question. There you go. You already know what the deal is. That's exactly what it means. By the way, if you don't like the F word, I'm sorry. It's going to be a hard time for you to be a nurse, let me tell you, because a nurse's favorite word is indeed the F word, especially when there's a code blue happening. And it happens right in front of you. So I'm just saying. All right, y'all. Hey, we need 10,000 likes or this is it for y'all. This is it on this Monday. Here we go. Here's our answer. Here is our Aunt Cursing Nursing. I love it. What's up, Samantha? And the answer is B. It is muscle spasm. Back pain or paresthesia in the lower extremities may indicate impending spinal cord compression from a spinal tumor. This should be recognized and treated promptly, as the progression of the tumor may result in paraplegia. Right? That is part of physiological adaptation, which is the 3rd largest section on the NCLEX at 11 to 17%. Remember, when you guys are reading your effing question, make sure when you're reading your question, read your effing answers. And then when you get it right or wrong, because you won't get them all right, read your effing rationale, RTFR. All right? Stop playing games with me. All right? Stop playing games with me. Get this learn on. You know what I'm saying? Get into a routine. Shout out to everybody that got that right. Ladies and gentlemen, hey, in case you don't know, I have a book. It's coming out. It's called Conquer It, The Journey to Passing the NCLEX. Why I failed my NCLEX 3 times, ladies and gentlemen. I failed it 3 times. And I didn't get my fucking act right until the 4th time. All right. And this is not going to be the run-of-the-mill type of book. This is a book about getting over those failures and those humps. Hey, you're not considered a failure if you don't quit. You're only considered a failure if you quit. And we don't quit around here. Don't none of y'all quit around here. I don't care how many times you have to take the NCLEX or how many times you're allowed. You keep going. If you really want your dream to be a reality, you don't quit. Just saying. So anybody interested, you guys can check out my book. It's pre-order right now. It's coming out June 5th, which marks my 4-year anniversary of becoming a nurse. And you guys can go check it out over there at thebootnurse.com/books. All right, y'all, here we go. Question number 11, point blank, period. Nurse Patricia is aware that the average length of time for HIV infection to develop to or of AIDS syndrome. What? How long does it take for HIV to become AIDS? There you go. Less than 5 years, 5 to 7 years, 10 years, more than 10 years. What are we thinking? Now somebody is just like, oh my God, this is really easy. Watch that same person that say this is easy get it wrong. I'm just saying. Shout out to all 340 y'all. We're doing NCLEX question. Let's go A, baby. All right. Shanice, I see you. All right. Is C. Okay. Or is it C? Are you asking me? What's up, Geraldine? I see you. It also depends on. Hey, don't say also depends on. Take the information that is given to you. All right. The information that is given to you. Natalie, how are you? Here we go. Here's our answer in 3, 2. And the answer is C. It is 10 years. What is it? Epidemiology, right? Studies show that the average time from initial contact with HIV to develop into AIDS is 10 years. The interval from HIV infection to diagnosis of AIDS ranges from 9 months to 20 years or longer, with a median of 10 years. That is physiological adaptation, which is the third largest section on the NCLEX exam. I'm a business major switching to nursing. Any tips? Start studying in time management, my guy. So that's physiological adaptation, 11 to 17% on the NCLEX exam. Megan, I know it's crazy out here. Eliza, thank you for the rose. Appreciate you. Hey, if you got it wrong, circle back, get that content, those questions, and get you rationales. That's the trifecta. That's what you need. Question number 12, an 18-year-old male client admitted with heat stroke began to show signs of disseminated intravascular coagulation, DIC. Which of the following laboratory findings is most consistent with DIC? All right. Is it low platelet count, elevated fibrinogen levels? Is it low levels of fibrin degradation products, or is it reduced prothrombin time? It says I'm screenshotting everything. Why? Just go to nurseslabs.com and you can go find them, because this is where I got them from. You're going to be sitting here filling up your whole phone with nonsense. And by nonsense, I mean NCLEX questions. And by NCLEX questions, I mean greatness. But anyways, shout out to y'all. Go to nurseslabs.com. They are free sets of questions. You guys can go over there and check them out for yourself. All right. If you're a nursing student and you need help with care plans, hey, they got good care plans over there. I used them when I went to school in 2017, 2018. So they're great. They're super helpful. All right, here we go. And the answer is A. It is low platelet count and DIC. Platelets and clotting factors are consumed, resulting in microthrombi and excessive bleeding. As clots form, fibrinogen levels decrease and the prothrombin time increases. That is reduction of risk potential, 9 to 15% on the NCLEX. That is the fourth largest section on the NCLEX exam. All right, management of care. Management of care, pharmacology, physiological adaptation, reduction of risk potential make up more than half of the exam. All right. It says, should I use nursing lab or Archer? I take my exam in 2 weeks. I don't know. That just depends on you. I personally like Archer, but that's just me. Everybody's different, but nurses, whatever one you want to use. Question number 13. Mario comes to the clinic complaining of fever, drenched night sweats, and unexplained weight loss over the past 3 months. Physical examination reveals a single enlarged supraclavicular lymph node. Which of the following is the most probable diagnosis? Is it influenza, sickle cell anemia, leukemia, or Hodgkin's disease? What are we thinking? Shout out to all 480 y'all, 500 y'all. We're doing NCLEX questions. Got them off nurseslabs.com. They are free sets of questions. Make sure you guys like, share, and follow. If you guys are new here, I want to know who you are, where you're from, and where you are at in your nursing journey. All right. Also could be TB. AJ, where do you see TB at on here? AJ would be that person to be like TB and be like, why'd I get it wrong? Come on, guy. Oh my God. I'll give y'all 15 seconds. My best friend died from Hodgkin's lymphoma. That's unfortunate. I'm sorry to hear that. It's D. Okay. All right, y'all. Got D, B. It's D. Okay. You're coming to the rabbit hole. Y'all better let them know. Here we go. Here's our answer in 3, 2. Shout out to Florida. And the answer is D. It is Hodgkin's disease. Hodgkin's disease typically causes fever, night sweats, weight loss, and lymph node enlargement. Part of physiological adaptation, 11 to 17%. Third largest section on the NCLEX exam. EA Green in California. All right. So, hey, when you get it wrong, because trust me, you will not get all of these questions right. The NCLEX, if you start getting all these questions right, the NCLEX is going to start giving you really hard questions. And that is the goal. The goal is to get to the hard questions, ladies and gentlemen. That is the goal. So you're not meant to get 100% on the NCLEX because that's not a thing. All right. Not even trying to be a nurse. Cool. As long as you're here rocking with us, that's cool. So hey, look, the goal is to get to the hard questions. All right. Shout out to Ghana. New here. Just passed my NCLEX. Who said that? Is it Yokavi? RN, you just passed your NCLEX. Hey, we're glad to have you here. Welcome. Congratulations on passing your NCLEX. Welcome to the greatest shit show on earth, known as being a nurse. If there is a piece of advice that you could give to people that are going to take their NCLEX, what advice would that be? Once again, congratulations to you. Linda, 32 years nursing. Linda, I'm 36. I don't know how that makes you feel. Anyways, question 14. A male client with a gunshot wound requires an emergency blood transfusion. His blood type is AB negative. Which blood type would be the safest for him to receive? Is it AB RH positive, A RH positive, A RH negative, or O RH positive? What are we thinking? What are we thinking? I got a bunch of people screaming C at me. Hey, if you guys are new here, a little bit about me. I've been a nurse for 3.5 years. This is both for RNs and LPNs. Been a nurse for 3.5 years. I was in the Navy for 16 years. I just got out in January, and I failed my NCLEX 3 times. So I don't care about what any of you have to say about me failing my NCLEX, because there's always somebody that got something to say that ain't walked a day in my shoes. There's always going to be somebody that's going to say something to y'all that ain't walked a day in your shoes. That's number one. Don't let people disrespect you like that. Number two, look. Get out of your own way. Get out of your own way. Get out of your own way. All right, y'all, here we go. Here's our answer in 3, 2. And the answer is C. I was about to say A, but the answer is C. It is A RH negative. All right, so human blood can sometimes contain an inherited D antigen. Persons with the D antigen have RH positive blood type. Those lacking the antigen have RH negative blood. It's important that a person with RH negative blood receive RH negative blood. That is part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. If you love to hate, you hate. Facts. Let them know. Hey, so shout out to everybody that got that question right. You guys already know the deal. Circle back if you got it wrong. By the way, something I do want to state is that if you're if you're an LPN going to take your PN exam, you learn the same exact content that the RN learns. You just need to know what you can and cannot do and what you can and cannot accept. Right? You know that you can't do initial teaching, LPN. You know that you cannot do IV medications. You can't do blood transfusions. It doesn't matter what your state says because the NCLEX is a national exam. Okay. So you need to know what you can and can't do, what you can and cannot accept. Shout out to you, Sherry. Is it Sherry from Australia? Hey, I'm glad that you're here. Hey, down under. You know what I'm saying? So appreciate you being here. Question 15. Stacy was diagnosed with acute lymphoid leukemia. She was discharged from the hospital following her chemotherapy treatments. Which statement of Stacy's mother indicates that she understands when she will contact the physician? I should contact the physician if Stacy has difficulty in sleeping. I will call my doctor if Stacy has persistent vomiting and diarrhea. My physician should be called if Stacy is irritable and unhappy. Should Stacy have continued hair loss, I need to call the doctor. What are we thinking? Shout out to all 500 of y'all rocking with me. We're doing NCLEX questions. I got them off nurseslabs.com. Nurseslabs.com. Free sets of questions for y'all. Y'all can go over there and check them out for yourself. Care plans. I don't give a shit if you think care plans are useless. Everybody needs a baseline. And if you're in nursing school, go over there and get those too. All right. Trisha says B. I got you. So I'm a vet, brother. I just got out 2 months ago and starting nursing school 2 months ago. Any advice? Steven, sir, time management is your best friend. Get into study groups. You for 3 other people, split the work up 25%. If somebody's ain't pulling their work, get that ass out. Get them out and get somebody in there that's going to be productive, because the mission entails that you get a degree and you get a license. You know what I'm saying? If people ain't pulling their work, get rid of them. So that's what I did. It worked for me while I was in school. And if it doesn't work for you, sorry, but it worked for me. I'm a social butterfly and it worked. But the answer is B. I will call my doctor if Stacy has persistent vomiting and diarrhea. Persistent, meaning more than 24 hours of vomiting. Anorexia and diarrhea are signs of toxicity, and the patient should stop the medication and notify the healthcare provider. That is part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. And think about it. Somebody who's going to have persistent vomiting and diarrhea are going to have an electrolyte imbalance, right? Think about that potassium, right? Think about my heart, think about dehydration, think about all that stuff. That's where you have to think to yourself. That's where you have to put your critical thinking into place. All right. In order for you to make a clinical judgment. Retired forensic nurse here. Any others? No, Mama Beans, I think you're alone on that one. But shout out to you being forensics. I know one other person that does forensics, and I know that they love it. Critical thinking is hard. It's not hard if you do it every day. You know what I'm saying? So, hey, but ladies and gentlemen, speaking of an NCLEX course and review, I actually have an NCLEX course. You can actually join it for $7 plus being a part of the community where I do live lectures. You can join it for $7 and then it goes up to $48. And that's only going to last for I don't know how long. So jump into it. I have a review where I break down each section of the NCLEX client needs, as well as a 100 question next generation NCLEX review where we go through case studies. We go through all kinds of stuff. So if you guys are interested in that, you guys can check the link in my bio, or you guys can go to thebootnurse.com/special and check that out as well. You get it, say $7 for 7 days. And if you don't like it, you can cancel your subscription. Or you could come hang out with me, whatever you want to do. So, hey, if you're interested, it's linked in my bio, or like I say, you can go to the website, okay? Here we go. Question number 16. Molly Sue, she must be really old, is diagnosed with acute lymphoid leukemia and beginning chemotherapy. Her mother states to the nurse that it is hard to see Molly Sue with no hair. The best response for the nurse is what? Now, this sounds kind of like a psych question to me. So remember, with psych, it's all about what? Good therapeutic communication skills. All right. So is it A, Molly Sue looks very nice wearing a hat? You should not worry about her hair. Just be glad that she's alive. That is a crazy statement. Yes, it is upsetting, but try to cover up your feelings when you are with her, or else she may be upset. Or is it D, this is only temporary. Molly Sue will regrow new hair in 3 to 6 months, but may be different in texture. What are we thinking? I'm telling you right now, I know what some of y'all are thinking. Whatever urges you have, don't you do it. Don't you pick the answer I think you're going to pick, okay? Don't you do it. Aaron says D. I got you, Aaron. Hey, if you guys are new here, welcome. We're doing NCLEX questions both for RNs and PNs. All right. God, I hate these. Don't hate. Hey, good. Hey, psych, good therapeutic communication skills. Okay. All right. Tell me more about how you're feeling right now. I'm going to say B. See, I knew it was going to be one person. Here, it says from a social worker, I feel it's C. Okay, well, let's see. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is D. It is D. This is only temporary. Stacy will regrow new hair in 3 to 6 months, but may be different in texture. This is the appropriate response. Danny, come on. You got to give yourself more credit than that, my guy. And I don't know if y'all know, but bald women, y'all are beautiful. You know what I'm saying? Stop playing games. Hair's overrated, baby. You know what I'm saying? But the nurse should help the mother how to cope with her own feelings regarding the child's disease, so as of not to affect the child negatively, right? When the hair grows back, it is still the same color, or it is still of the same color and texture. That is psychosocial integrity. psychosocial integrity, which is 6 to 12% on the NCLEX exam, smaller section, but still very, very much important. And I would like to do this course right before the NCLEX. I don't know. Are you asking me? So I don't know. But anyways, so shout out to y'all that got it right. If you didn't get it right, hey, if psychosocial integrity or psych questions are those questions that, really give you a hard time, hey, circle back and get that content in those specific areas. All right. So here we go. Question 17. Brittany, who is undergoing chemotherapy for her throat cancer, is experiencing stomatitis. To promote oral hygiene and comfort, the nurse in charge should what? All right. Is it provide frequent mouthwash with normal saline? Apply, viscous Listerine to oral ulcers as needed? Use lemon glycerin swabs every 2 hours, or rinse mouth with hydrogen peroxide? What are we thinking? Candace says C. Okay. I'm on the fence. Of going into nursing. I finished EMT 2 months ago ahead of my class with honors. I don't know. Well, I mean, do you, bro? Do you? If you're an EMT, you could become a nurse and then go do flight, or do en route critical care. You could do stuff like that too. The thing about medicine is that there's so many places that you can go. You just find your spot. Some people become nurses and then they're just like, fuck it. I don't know why I became a nurse. I'm going to go be a doctor. People do that too. I was a combat mech in the Army. Cool. I was a hospital corpsman in the Navy. I was a surge tech for a while. I ended up being a master instructor for the last 9 years, in the Navy. So, hey, listen, man, I get it. All right. So, but the answer is, it's B. Apply viscous Listerine to oral ulcerations as needed. Stomatitis can cause pain. Stomatitis can cause pain, and this can be relieved by applying a topical anesthetic such as Listerine before mouth care. All right. So that is basic care and comfort, which is 6 to 12% on the NCLEX exam. Somebody said lemon is acidic. There you go. I'm an OR nurse. You've done well. On your resume. What you mean? I've done well on my resume? Are you talking to me or are you talking to the other guy? All right. But basic care and comfort, smaller section. Hey, basic care and comfort is fundamentals, ladies and gentlemen. Fundamentals. Did I say Listerine or I say lidocaine? I said, oh, that's my bad. I'm sorry. Hey, I'm glad y'all picked it up. I'm glad it's lidocaine, not Listerine. Oh, I hate every single one of y'all. I smash the like button, stop playing games with me. You know what I'm saying? But hey, I'm a little dyslexic. All right, don't judge me. Question number 18. During the administration of chemotherapy agents, Nurse Oliver observes that the IV site is red and swollen when the IV is touched. Stacy shouts in pain. The first nursing action to take is what? Do I notify the healthcare provider? Do I flush the IV with saline solution? Do I immediately discontinue the infusion? Or do I apply an ice pack to the site, followed by warm compress? What are we thinking? I can't even believe I sat here and said Listerine. Ashley, I appreciate you with the TikToks. Thank you. Vina, why are you telling me please? I mean, I don't know what the answer is. We finna find out. Hey, if you're between two answers, hey, make a decision and run with it. Snuggles is like, come on, bro. I've been getting them wrong. I need this one. I did the nurse knock first. All right, y'all, here we go. Let's see what the answer is, y'all. Let's see what the answer is in 3, 2, and there it is. Hey, shout out to y'all that chose C. C is the correct answer. Immediately discontinue the infusion. Edema or swelling at the IV site is a sign that the needle has been dislodged and the solution is leaking into the tissue, causing the edema. The patient feeling pain as the nerves are irritated by pressure and the IV solution. The first action of the nurse would be to discontinue the infusion right away to prevent further edema and other complications. That's actually part of management of care, which is the largest section on the NCLEX exam at 18 to 23%. All right. Management of care. Remember, delegation, assignment, supervision, managing the care of individuals and of multiple individuals. I don't know, Vina, you tell me. Vina, should you take your NCLEX again? I don't know. Do you want to be a nurse? You tell me. If you want to be a nurse, absolutely. If you don't, then then do you. But I'm telling you, if you want to be a nurse, that ass better get up and dust your shoulder off. Wipe those tears up and go take that exam again. Just saying. Anyways, question number 19. The term blue bloater refers to a male client. Which of the following conditions? Is it acute respiratory distress syndrome, asthma, chronic obstructive bronchitis, or emphysema? Hey, Vina, I don't know if you're new here, but I'm a real straight shooter. Hey, you get 1 day to cry in front of me about you failing any exam, and then I'm going to ask you, what are you going to do to fix it? What are you going to do to fix it? Each journey is different. No one asked me if I passed on the first time. Trina, it's been a while since you've been in here, but let them know. Let them know. You know who will never ask you? Your job and your patient. You will learn how to be a great nurse when you start working as a nurse. This exam is all about the bare minimum. It is about the basics of the basics, and you need to know what everybody else knows. That's what it is. All right. So get out of your own way. Get out of your own head. All right. You think that anybody else is thinking about the fact that you failed? No. You think the NCLEX, a computer adaptive exam, is going to sit there and be like, well, I made Vina fail. Yeah. No, come on. That exam has no emotional ties to you. So why you got so many emotional ties to it? You know, I'm just saying. I say this all out of love because I want every single one of y'all to go out there and conquer. Whoa, who just told me they passed? It said, oh, I got to pass. Hey, if you got to pass, put the work in. I'm just letting you know. And the answer is C. It's chronic obstructive bronchitis. Clients with chronic obstructive bronchitis appear bloated. They have large barrel chest and peripheral edema, cyanotic nail beds, and at times circummoral cyanosis. That's physiological adaptation. Third largest section on the NCLEX at 11 to 17%. All right. People are in here telling me that they got to pass. I'm telling you right now. Yeah, you got to pass. But if you don't put in the work, you ain't passing nothing. You know what I'm saying? I hear so many people say the NCLEX was easy. Bro, the NCLEX was easy for you. And if the NCLEX was so easy, it would be 100% pass rate. And it's not. So get out of my face. Anyways, question number 20. The term pink puffer. Man, are these like vape pens? Like what the fuck? I'll just play it. Refers to the female client with which of the following conditions? Is it ARDS, asthma, chronic obstructive bronchitis, or emphysema? Kelly, what you crying for? This is fun. I'm glad y'all think this is fun. All right. That's one thing about me teaching. I've been teaching for 9 years and I can't do just the regular PowerPoint. I gotta bring some type of socialness into it. If I was actually in front of a class, it would be wild up in here. All right. Hey, shout out to everybody out here rocking. We're doing NCLEX questions. I got these questions off nurseslabs.com. They are free sets of questions. You guys can go over there and check them out for yourself. Make sure you guys keep liking, smash that like button. Make sure you guys share, you guys follow. That is the trifecta that TikTok needs. That's the trifecta that TikTok needs, for me to get in front of people's faces or, figuratively, literally. But the answer is D. It's emphysema. Because of the large amount of energy that it takes to breathe, clients with emphysema are usually, is it cachectic? There it is. I remember it's cachectic. They're pink and usually breathe through pursed lips, so pursed lip breathing. Hence the term puffer, right? Physiological adaptation. Physiological, Vina, I saw you got that right. Physiological adaptation, third largest section on the NCLEX exam. Third, Julia, what's up, Miss Lady? Physiological adaptation, third largest section on the NCLEX at 11 to 17%. All right. So make sure you guys go over there to nurseslabs.com if you guys want those free sets of questions. How much is your class? It's $7 to start. And then it goes to subscription to right now. It's currently at $48 a month. But ladies and gentlemen, hey, remember, like I said, I failed my NCLEX 3 times. Right. And then I passed on the 4th. So many of y'all get scared about taking this exam. But check this out. If you're one of those individuals who's scared to take your exam, if you're scared of failing again, if you don't know where to start, if you lack motivation and accountability, come check me out. I actually do NCLEX coaching. I literally only take like 5 to 6 people a month because I'm really honed in on y'all. But if anybody's interested in that, you guys can check out thebootnurse.com. That will take you to my website, fill out the questionnaire, and then book a call with me. And then, come holler at me. I'm just saying, if you guys want to see the testimonies, you guys can go over to my page or check me out on YouTube. They're over there as well, right? So, hey, never give up. Never give up. If you want your dream to be a reality when it comes to being a nurse, you better never give up, because it's always going to be a dream, because only you can put the work in. All right. So question number 21. Jose is in danger of respiratory arrest following the administration of a narcotic analgesic. An arterial blood gas value is obtained. Nurse Oliver would expect the PaCO2 to be which of the following values? All right, is it 15, 30, 40, or 80? What do we think, Josie? This is for RNs and LPNs, RT to RN. Hey, I'm telling you right now, anybody that is ever going to the ICU, you better lock in with an RT to learn everything that you can learn about the vents. Everything about the vents. All right. Shout out to all 500 plus of y'all. It says, I can't remember the norms. You better remember the norms. Hey, remembering the lab values is part of studying for your NCLEX. Now, here's something I will say. They will have the values on NCLEX. They will tell you what the normal values are. But if you don't know what they mean when they are out of range, it doesn't matter. If you don't know what it means when they are out of range, whether it is too high or it is too low, it does not matter. That means you need to know what is happening with your patient. That way you can make a good, safe, clinical judgment when it comes to picking your answer. All right. I just don't remember the numbers. Cool. If you don't, I'm just saying, a lot of people get hung up on not remembering the numbers. And I was like, well, they're going to give you the numbers, but if you don't know what they mean, it's pointless. All right. But the answer is D, 80 millimeters of mercury. A client about to go into respiratory arrest will have insufficient ventilation and will be retaining carbon dioxide or CO2. The value expected would be around 80 millimeters of mercury, right? All other values are lower than expected. That is reduction of risk potential, which is 9 to 15% on the NCLEX exam. That's the fourth largest section on the NCLEX exam based off of the 2023 NCLEX test plan that came out last year on April 1st. Not a joke, not a game. This is real. And if anybody ever wants to see that, you guys can, go over to the ncsbn.org and look it up. So Jaden was reported, pay no mind. What happened? What happened? What happened? Block her ass, Rudis foot. Whoa, what happened? Time out. What happened? Hey, who acting up in this chat? I'm hard pausing right now. Hold on. Oh, so somebody came in here acting up. All right, cool, whatever. Anyways, I'm pretty sure I think Julia's still in here. Julia, if you block that person, I appreciate you. Question 22, Timothy's ABG results are the following. It's a pH of 7.16, a PaCO2 of 80, a PaO2 of 46, a bicarb of 24, an SaO2 of 81%. These ABG results represent which of the following conditions? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, or respiratory alkalosis. What are we thinking? Everybody's screaming C at me. All right. Shout out to all 666 of y'all. Literally, that was the number. So all you superstitious folks, I'm just letting y'all know. Hey, give me the 30,000 likes to stop playing game. Doing NCLEX questions both for RNs, registered nurses, and licensed practical nurses. Got them off nurseslabs.com. They are free sets of questions. Make sure you guys go over there and check those out for yourself. And the answer is C, respiratory acidosis. Shout out to all of y'all that got that question right. Reduction of risk potential, 9 to 15% on the NCLEX, making it the fourth largest section on the NCLEX exam. Because PaCO2 is high at 80 millimeters of mercury and the metabolic measure bicarb is normal, the client has respiratory acidosis. Not a nurse, was an EMT. Shout out to you, Becky. Question, after you fail, how long would you receive your report? So some states are immediately, some states it takes a couple weeks because they come in the mail. It all just depends. Oh my God, this is a sign I need to take NCLEX again. I got it right. You should just take it again regardless. I'm just saying, but here's the thing. If you're not prepared to take the exam, then you're going to have the same results. Y'all know what the definition of insanity is? Doing the same thing over and over and expecting the same result. So if you don't study different, based off of what you did wrong the first time, you're going to fail again. So I would recommend that you fix yourself. Just saying. Here we go. Question number 23. Norma has just started a new drug for hypertension. 30 minutes after she takes the drug, she develops chest tightness and becomes short of breath and has tachypnea. She has a decreased level of consciousness. These signs indicate which of the following conditions. Is it an asthma attack, pulmonary embolism, respiratory failure, or rheumatoid arthritis? What are we thinking? I'm in my first semester. When should I start knowing this info? You don't really need to know this info now, but you really got to start studying heavy for NCLEX your last semester in nursing school. What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions, both for RNs and LPNs. Make sure you guys smash that like button. You guys share and you guys follow. Make sure you guys follow and hit that notification bell so you know when I go live. Because I go live every Monday, Wednesday, Friday at 5:30 Central Standard Time. Also, on Thursday, 7 p.m. Central Standard Time, myself, Nurse Glamour, and Nurse Larissa are going to be doing a collab here on TikTok, doing some talks. So make sure you guys share, you guys follow, and you guys are here for that. All right, here we go. Here's our answer. Here's our answer in 3, 2, and the answer is C, respiratory failure. The client was reacting to the drug with respiratory signs of impending anaphylaxis, which could lead to eventually respiratory failure. That is physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. Light work, I see you. You know what I'm saying? 11 to 17% on the NCLEX exam, making it the third largest section on the NCLEX exam. All right. So make sure you guys circle back, get the content, still do your questions, and get your rationale. All right. Here we go. Question number 24. Mr. Gonzalez was admitted to the hospital with ascites and jaundice to rule out cirrhosis of the liver, which laboratory test indicates liver cirrhosis. Is it decreased red blood cell count? Is it a decreased serum acid phosphatase level, an elevated white blood cell count, or an elevated serum aminotransferase? Oh, no lie. I thought somebody said duh. I'm like, oh my God. Shout out to all of you. Hey, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. That's what I want to know. And if you're not a nurse or anything of the sort medically, what are you doing here hanging out with us? It says the NCLEX is the same in Canada, but our blood sugar values are so different than in the States. Yeah, tomato, tomato. Tomato, tomato. 3 months in the LPN program. Shout out to you. Jacksonville, Florida, in the NICU. Hey, shout out to Duval County. You know what I'm saying? I lived there, for about a good 4 years. Duval, you know what I'm saying? Shout out to Jacksonville. I'll never go back there and live, but Nissa from, is that Michigan? Louisville, Duval, there you go. JU Nursing, as in Jacksonville University. Shout out to you, Lauren. I think that's what that means. Vancouver, okay, that's new. First time. Shanice, I see you. From the Philippines, Teresa, I see you. Shout out to all y'all that are in here, man. I love that y'all come here and y'all come hang out with me. Y'all come get y'all's learn on. All right, I'm an RN new here from Jamaica. Shout out to Jamaica. Merlin, okay. Fleming Island, ew. What is that? That's right off Roosevelt. Yeah, you think I don't know that? I used to live over there. I used to live in Orange Park. You know what I'm saying? I used to live off Blanding. You know what I'm saying? I used to live over there. So shout out to y'all. Whoa, I just passed my NCLEX last Feb. Shout out to you. So here we go. And the answer is D, elevated serum aminotransferase, right? Delaware, that's a state. I'm just playing. Guyana, okay. Hepatic cell death causes the release of liver enzymes, ALTs and ASTs and D or LDH into circulation. Liver cirrhosis is a chronic and irreversible disease of the liver characterized by generalized inflammation and fibrosis of the liver tissues. That's a reduction of risk potential, which is 9 to 15% on the NCLEX exam. All right, for both RNs and LPNs. All right, LPNs, I need for you to really understand this. You learn the same content that the nurse learns, that the RN learns. You're both nurses, but the RN. You learn the same content. You just need to know what you can and cannot do and what you can and cannot accept. It says Dayton, Ohio, near Wright Pack. Shout out to you. I got a buddy that lives up in Ohio. He does TCCC stuff. So shout out to everybody got that question right. Ladies and gentlemen, question number 25. The biopsy of Mr. Gonzalez confirms The diagnosis of cirrhosis. Mr. Gonzalez is at increased risk for excessive bleeding primarily because of what? Is it impaired clotting mechanism? Is it varix formation, inadequate nutrition, or trauma of invasive procedure? What are we thinking? What's up? Oh, we got everybody screaming A at me. Okay. Can we do some fluid and electrolyte? Hey, Tori, we're just gonna do whatever questions we got. And usually the questions are just kind of mixed. So, maybe I might do like a subscription thing on here. And the people that are part of the subscription, like we'll do them upon request. I don't know. We'll see. Thanks, Tori. I appreciate you. Here we go. Here's our answer. Geraldine says it's A. Everybody's screaming A. All right, well, let's see. And the answer is also A. All right, it is impaired clotting mechanism. Cirrhosis of the liver results in decreased vitamin K absorption and formation of clotting factors resulting in impaired clotting mechanisms. That is reduction of risk potential, which is 9 to 15% on the NCLEX exam. 9 to 15% on your NCLEX exam per the NCLEX test plan. Okay, 9 to 15%, fourth largest section. So shout out to all of y'all that got that question right. Ladies and gentlemen, if y'all don't know who this strapping melanated gentleman is here, this is AJ, Antoine AJ Inslee. He actually was the last was one of my last students that I coached to pass NCLEX. He passed NCLEX on the 15th of February. Now my man is working in a cardiovascular ICU on his way to his dream to being a CRNA. So I'm just wanting to let y'all know coaching works. Coaching works. So if you're one of those people who needs help, who's failed the NCLEX, you don't know where to begin, check the link out in my bio for NCLEX coaching, and let's see what we can do for y'all. But my man looked good, you know what I'm saying? So shout out to him. I know he kind of lurks. So went to Chamberlain. Or I went to school with him at Chamberlain. Shout out to you, Hunter. So Hunter, you know what's up. You do online coaching. I do online coaching, but specifically for NCLEX, and it's one-on-one coaching. All right. So here we go. Question number 26. Mr. J develops hepatic encephalopathy. Which clinical manifestation is most common with this condition? Is it increased urine output, altered mental status, decreased tendon reflex, or is it hypotension? What are we thinking? Shout out to everybody that's in here rocking with me. Hey, a little bit about me. I've been a nurse for 3.5 years. I've worked ICU, specifically in a burn ICU and a medical ICU. I've also floated to neuro. I worked PACU, as well as I've worked in the operating room. I was in the Navy for 16 years. My last 9 years of service, I was a master instructor. So I taught in the surgical technology program. I'm a trauma nurse instructor now. I taught pre-hospital trauma, ACLS, ABLS, BLS. I taught a lot. So I enjoy teaching. I enjoy doing this TikTok. This is exactly why I do TikTok, mostly because no college would hire me. And I don't know why, but hey, this is what I like to do. And I appreciate everybody being here, getting their learn on. But the answer is B, altered level of consciousness. Changes in behavior and level of consciousness are the first signs of hepatic encephalopathy. Hepatic encephalopathy is caused by liver failure and develops when the liver is unable to convert protein metabolic product ammonia to urea. The result is accumulation of ammonia and other toxics in the blood that damage the cells. Physiological adaptation, third largest section on the NCLEX. Okay, accumulation of ammonia. Did I say anemia? I'm in ammonia. Damn, see, my bad. Y'all know what I'm talking about. But third largest section on the NCLEX exam, physiological adaptation, 11 to 17%. All right, so shout out to all 500 plus y'all that got that right. All right, so make sure y'all keep smashing that like button, but here we go. Question number 27. Patrick, who is diagnosed with liver cirrhosis, is experiencing symptoms of hepatic encephalopathy. The physician orders 50 mLs of lactulose PO every 2 hours. Lord have mercy. Hold on a second. Oh, that is different. Man, okay. Patrick suddenly develops diarrhea. The nurse best action would be to what? I'll see if your physician is in the hospital. Maybe you're reacting to the drug. I will withhold the next dose. I'll lower the dose as ordered so the drug causes only 2 to 4 stools per day. Frequently, bowel movements are needed to reduce sodium levels. What are we thinking? I don't know why that was so hard to read. Is it just me? It says D, therapeutic effect to excrete ammonia. Okay. All right. What else are we thinking? Shout out to everybody just now joining. We're doing NCLEX questions both for RNs and LPNs. Appreciate everybody being here. Make sure you guys like, share, and follow. Get it to the For You page. I know a bunch of y'all came in here from the For You page, right? So, and of course, if this is helpful for you, and if you know if it's helpful for somebody else, share it to them. All right? Share it to them. Don't be greedy. Here we go. Here's our answer in 3, 2. And the answer is C. Somebody just said it. There was just like, it's not sodium, so it's C. Hey, way to read the question. Way to read the question, but also good job on reading the answers. RTFQ, RTFA, RTFR. All right. So lactulose is given to a patient with hepatic encephalopathy to reduce absorption of ammonia in the intestines by binding with ammonia and promoting more frequent bowel movements. If the patient experiences diarrhea, it indicates overusage, and the nurse must reduce the amount of medication given to the patient. The stool will be mushy or soft. Lactulose is also very sweet and may cause cramping and bloating. That's part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX at 13 to 19%. All right. This is why you have to read the fucking question, read the fucking answers, also as read the fucking rationales. All right. So shout out to y'all who got that right. I'm glad I saw that last one there. I was just like, oh, that was like right before I had moved over. E-money, E-money, stop laughing at me. All right. But shout out to y'all who got that question right. Okay. Hey, as long as you know what the deal is. All right. But here we go. Question number 28. Which of the following groups of symptoms indicate a ruptured abdominal aortic aneurysm? All right. Is it lower back pain, increased blood pressure, decreased RBCs, and increased WBCs? Severe lower back pain, decreased blood pressure, decreased RBCs, increased WBCs? Severe lower back pain, decreased blood pressure, decreased RBCs, and decreased WBCs? That's in there twice. Or is it D, intermittent low back pain, decreased blood pressure, decreased RBCs with an increased WBC? What are we thinking? What are we thinking? Got B's. Everybody screaming B at me. Danielle. Is it Danielle? Thank you for the follow. Appreciate you. Just kidding. It's B. Are you sure? Geraldine says it's B. Okay. All right. We got K says it's C. You have no idea? Jill, give me a guess. Here's the thing. By you guessing 25%, you have a 25% chance of getting it right versus if you don't answer at all. Right. And on NCLEX, you have to give an answer. You can't go on to the next question without answering. All right. You're going to guess B. Okay. So here's where I would recommend where we go back and we look at our content, right? And we circle back to know what the process is with regards to an abdominal aortic aneurysm or a AAA. All right. Here we go. Here's our answer in 3, 2. And the answer is B, severe low back pain, decreased blood pressure, decreased RBCs with an increase of WBCs. So severe lower back pain indicates an aneurysm rupture secondary to pressure being applied within the abdominal cavity. When rupture occurs, the pain is constant because it can be alleviated until the aneurysm is repaired. Blood pressure decreases due to the loss of blood into the abdominal cavity, y'all. Where else do you think the blood's going? Okay. After the aneurysm rupture, the vasculature is interrupted and blood volume is lost. So blood pressure wouldn't increase. For the same reason, the RBCs have decreased, not increased. The WBCs increase as cells migrate to the site of injury. That is physiological adaptation. Third largest section on the NCLEX at 11 to 17%. All right, 11 to 17%. Understand how these disease processes work, ladies and gentlemen. That is how you're able to use your critical thinking to make a clinical judgment. All right. Here we go. Question number 29. After undergoing a cardiac catheterization, Tracy has a large puddle of blood under her buttocks. Which of the following steps should the nurse take first? Keyword is first. All right. What is the very first thing that you're going to do? Call for help. Are you going to obtain vital signs? Are you going to ask the client to flip over? Or are you going to apply gloves and assess the groin site? What are we thinking? Ellie, what are you talking about? Ellie said not necessary. What are you talking about? What are we even talking about? Shay says rebleed. Okay, Ellie. I'm like, what are we talking about? So somebody in here says always assess. That's not always true. However, you assess when you don't have enough information, right? But if you have enough information, because, it's assess versus implementation, right? So I assess if I don't have enough information. Now, if I have enough information, then I can go ahead and I can jump in, right? Assess before you do, unless delaying doing, causes further injury. Does that make sense? What you mean call you out? You literally just put it in the chat, so it's public. Huh? What do you even mean? Ma'am, respectfully, you really gonna do that right now? Now you just called yourself out. It's Gel, y'all. Gel. It was her. I want everybody to send her flowers right now. Do it, and do it now. All right. And the answer is D, apply gloves and assess the groin site. Okay. It says observing standard precautions is the first priority when dealing with any blood fluids. Assessment of the groin site is the second priority, right? This establishes where the blood is coming from and determines how much blood has been lost. The goal in this situation is to stop the bleeding. All right, that is a reduction of risk potential, which is 9 to 15% on the NCLEX. Fourth largest section on the NCLEX exam. All right, notice I didn't say that you were wrong for assessing. I'm just saying that assessment may not be the answer all the time. It depends on what is given to you. If there's more than enough information that's given to you, then you can go ahead and you can implement. You can go ahead and jump right in. All right. So just saying, it says we grab them 4x4s and we hold. That's right. Sometimes we drop a knee, maybe an elbow on it, maybe not. I've been thinking about field stuff too much, so my bad. So shout out to all y'all that got that question right. Okay. All right. Question number 30. Which of the following treatments is a suitable surgical intervention for a client with unstable angina? Is it a cardiac catheterization, an echocardiogram, nitroglycerin, or a percutaneous transluminal coronary angioplasty? What are we thinking? We got C. Okay. Somebody's telling me D. C with a question mark, Gel. C, PO. Okay. A, nitro isn't surgical, though. Read the question, guys. Read the question. Read the fucking question. Hey, this is when all 550 of y'all go take your NCLEX. If you're taking your NCLEX, I want for y'all to hear it. I want y'all to hear my succulent voice in your ear saying, read the fucking question, and then insert your name. So if your name is Gel, read the fucking question, Gel. You see what I'm saying? Read it. Read it. All right. Now let's see what our answer is. Okay. Lily, you know me? Okay, I got you. It says I need to stop looking at the comments. I'm getting confused. Look at you, Ellie. All right, well, let's see what the answer is. In 3, 2, and the answer is D. It's a percutaneous transluminal coronary angioplasty. All right. The PTCA can alleviate the blockage and restore blood flow and oxygenation. Boom, Joy, you know what's up. You knew it? Ellie, why you lying? You didn't know it. Now you're trying to say that you knew it. You lying to me. So it says veteran. Okay, you got A. We already done. All right, and that's part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. It says, well, I'll just jump off a bridge. Ariana, don't do that. We'll have to send you to psych because you're over here making suicidal ideations, and we don't want you to do that. All right. We got plenty of nurses that are going to come in here and start asking you, are you going to hurt yourself? Then we're going to come and detain you, stuff you in a wall, in a room somewhere, a padded room. Be careful. All right. I don't want that happening to you. I'm gonna have to report. Hey, don't do that. Hey, I'm just playing. Don't report her, y'all. Don't report her. Ariana, you're good. You're not going to do it, right? We're not going to do it. Ladies and gentlemen, of course, just to do a little roundup, hey, test taking tips. You guys can find all of these in my bio as well in my link tree. But test taking tips, go get them. They're free, 42 pages. I got an ebook, 700 pages. I got some EKG. I got a bunch of EKGs in there. What else I got? I got pharmacology in there, management and delegation, all kinds of stuff. Ladies and gentlemen, you can join the 7-day NCLEX course for just $7. Just $7. All right. The link is in my link tree in my bio, or you can go to bootnurse.com/special. Also, anybody that wants one-on-one coaching to help them conquer the NCLEX, check me out right there, bootnurse.com/coaching. And so it's $7 for 7 days. So you get to try it out for 7 days. If you don't like it, you can cancel it or whatever. And then it goes to $48 a month. So, and yes, lover, it's over. It's over. It's over now. Move over. Am I showing my age? Whatever. Ladies and gentlemen, that is a wrap up. That is a wrap up. Hey, I went on vacation after NCLEX too. So that's a wrap up. I appreciate everybody participating. You guys got me to 34,000 likes. I appreciate you. I really, really do here on this Monday. Wait, today's Monday? Yeah, Monday. I appreciate all the love and all that. Somebody got banned. I don't know who they were. They were pointless. And I wish I knew their name so I could talk shit anyway. But, once again, I got these questions off nurses, meaning more than one. Labs, also meaning more than one.com, meaning the internet. So nurseslabs.com for you guys. You guys can go over there and check those out for yourself. Hey, go check out the 7-day NCLEX course. You can be part of the community. I'm doing a lecture on Wednesday. It'll probably be on MedSurge. And you can join it for $7. It's the bootnurse.com/special. Like I said, I got that free download over there. Hey, don't forget, I got a book coming out, Conquer It. Check it out, link out in my bio. Also, if you want coaching, check me out. But until then, I'll turn this thing around so y'all can look at my face. Hey, I'm kind of froed out right now. Forehead game is on. But anyways, what's up, y'all? How y'all doing? It'll be Wednesday, Wednesday at 5:30 Central Standard Time. All right. My boy AJ said, what's good? Hey, AJ know what's up. AJ got my number. So AJ know what's up, Hunter. You know what I'm saying? He know what's up. So yeah, I made it. That's what I'm talking about. Hey, so you guys, we just did NCLEX questions. We do them every Monday, Wednesday, Friday, 5:30. You looking good, Nurse Kev? Caramel. I appreciate you. What's up, Kev? What's up, Jason? How are you? Thank you. Good practice and informative. Brian, I appreciate that. Looking good. Thank you. I appreciate that. What time? 5:30. Also, never mind. It was in my bio, but I took it off. Monday, Wednesday, Friday at 5:30. I take my NCLEX in 2 weeks and I can't breathe. That's not true because how are you living? Silly woman. My goodness. Thank God you came across my For You page. That's what I'm talking about. Is it Kali? I'm glad that people were, smashing the like button and sharing so I could end up on your For You page. So it says, Michelle says, I got the 7-day ink. I got the 7-day. It's so good. Michelle, I'm glad that you like it. I actually have been recording some content videos that are going to be going up here in the next couple weeks. So be ready for that. Do you do case studies? I do case studies. I think I did one last week. Thank you for this. You're welcome. Thank God I saw. I'm glad that you're here. Hello, my uncle Ariana. What's up, baby girl? How are you? It says, before it's over, would you mind explaining a quick question regarding meds? Maybe. It just depends on what it is. It says, y'all see how he be coming for. Ma'am, you did it to yourself. I don't even want to hear that. It says, hold on, medications are important on the NCLEX. I've been slack. Yes, medications aren't. Pharmacology is the second largest section on the NCLEX exam. The second largest section. You need to know it. And you want to know why you need to know it? It's because when you get out here and you start passing medications, you're not trying to be a redondavat. You know what I'm saying? You're not trying to come out here and start giving people the wrong medications. You see what I'm saying? Dobutamine and dopamine are very different. All right. So what's the largest section on the NCLEX? The largest section for RNs, it is management of care. And for LPNs, it's coordinating care. All right. That's what they are. Management of care makes up 18 to 23% on the NCLEX. It says farm is going to be my 13. Ma'am, that's twice. Hey, Ariana Grocia, ma'am, look, I'm going to have to follow you and make sure that you're safe, okay? Because you're starting to scare me. Amina says, thank you so much. I've been listening to your lives every week. I passed my NCLEX February 23rd. That's what I'm talking about. Y'all, give Amina right now all the love in the world. Congratulations to you on passing your NCLEX. Welcome to the greatest shit show on earth. If there's a piece of advice that you could give, what advice would that be? Once again, congratulations. Any tips for farm struggling big time? Here's what I'll tell you. Is you need to know the family name, the suffix, and it's an umbrella factor. I'm going to stick to cardiology or cardiac medications. If you need to know what cardiac medications are, all the cardiac meds, A, B, C, D, right? So ARBs, ACE inhibitors, beta blockers, calcium channel blockers, digoxin, diuretics, anticoagulants, antiplatelets, so on and so forth. Are they inotropic, chronotropic, or dronotropic? Do they increase heart rate? Do they decrease heart rate, blood pressure? Do they strengthen the heart, weaken the heart? That's what you have to know. And then you have to know the safety implications of when you give those medications. So orthostatic hypotension, right? That's a big one when people are standing up, right? So got to think about that. Ariana says ABCs. It says, oh my God, I'm so blessed that I found you. I'm glad that you found me too. I'm blessed that you found me. So I'm happy for you. It says, does TBON require foreign license for one to sit for the NCLEX? You have to have, if you're a foreign nurse coming into the United States or even Canada, you have to have all of your stuff from wherever you're from transferred to the United States or Canada. They go through a vetting process. And once they give you the thumbs up, then you can sit for the NCLEX. But you have to have gone to some type of accrediting body of an institution in order for you to sit for the NCLEX. All right. It says, does management mean between these patients who are yes, delegation, assignment, supervision. Okay. Let's just say, Kaylee says, can all anticoagulants be used for AFib? So anticoagulants, yes. What they'll say is they will give you one of the medications. Right? You just need to know which one is an anticoagulant for a patient that is displaying AFib. All right. So you really don't have to know all of the nitty gritty, but you need to know what an anticoagulant is and which one that you would use for that specific, that dysrhythmia. Archer's cool. You're a good teacher. I appreciate that. I've been teaching for 9 years. So I've been doing this for a while. Is fundamentals cover? Fundamentals does not cover 50%. It's management of care, pharmacology, physiological adaptation, and reduction of risk potential it's more than 50%. Those 4 sections alone. I am from Kenya and only have my certification, no license. So Faye, what you would have to do is if you went to a nursing school in Kenya and you're coming here to the United States, you would have to send all that paperwork from your school, transcripts and everything to the United States in order for it to get vetted to make sure that everything is good. If everything is good, they're going to send you a reply saying, yeah, you're good to take the licensing exam here in the States. Currently in the States, but studied in Kenya. Okay, that's what I thought. User 44, I think I answered your question. Hey, ladies and gentlemen, I appreciate everybody here rocking with me. I'm going to hang out for a couple of more minutes. So what other questions do you guys have? What other questions do you guys have? What other questions do you guys have? Shout out to all 119 of y'all. Hey, we did NCLEX questions. We do NCLEX questions Monday, Wednesday, Friday at 5:30. Started a little late because I had an appointment, So what other questions do you guys have? Well, let's see. Thanks, Brian. My name's not Brian. It's Kevin, but whatever. Cool. I guess I'll be Brian today. I went to school for 4 years. Ain't cramming nothing. Cool. I know that's right. We don't cram around here. What's included in your mentorship and tutoring? You can go to my website, Crystal, and on my website it'll tell you everything that is in the mentorship and tutoring. It's thebootnurse.com/coaching, but you can find that in my link in my bio. The price depends. It really does depend. Some people need more. Some people need less. Like I said, you can also go over there and check that out as well. But like I said, the price differs. Some people only needed me for a week. Some people needed me for 2 weeks. Some people I was with for 90 days. You can't afford to fail again. Well, you got to put it. You got to put in the work. You got to put in that work. My recommendation to a bunch of people: if you fail your exam, go over your CPR, your candidate performance report, and see where you were lacking. Okay, so if it's pharmacology, that's how you know. That's where you know you have to start first. I'm definitely going to have to use my summer to learn the meds. Yes, you need to learn the meds. And I've actually been hearing that in a lot of nursing programs that they're not even going through pharmacology. I'm like, what? They were just like, yeah, my nursing program didn't have pharmacology. I'm like, what nursing program didn't have pharmacology? All that does, it totally sets y'all up for failure. Ariana, that's terrible. That's terrible. That's terrible. They brush that stuff off. No, that's important. They factor it into each med-surg unit. Okay, then that's different. Because the way that everybody was explaining it to me is like, pharmacology just wasn't told. And I was just like, huh? I was just like, that's on the test plan. You need to know it. You need to know that. Mine didn't have pharmacology, but they put it into each semester. Okay, cool. Good. Who said that? Joanna said that. Okay, cool. Got you. Joanna. All right, got it. It says mine don't. They just say, here's a list of meds that's very common for each department. Lord have mercy. Lord have mercy. It says, so for cardiac, we did the cardiac meds. Okay, makes sense. But not too in depth, just the nursing implications for each. Okay, well, I guess that makes sense. However, you got to know them because you got to know what they do. You got to know what they do. It says, did they tell you on NCLEX which section you didn't do great on yet? Is it Nazet or Nazet? They do. So when you get a performance breakdown, I don't know where my paper's at. I usually have it. But you'll get a performance breakdown and it'll tell you each section that you didn't do well on. Hold on, let me see if I can find it. Choo choo train. Hey, don't y'all go nowhere. All right. So check this out. Right here. So this was my very first NCLEX failure. Lord have mercy, Kevin, you are slow. Anyway, so this right here is when I didn't pass the NCLEX exam the first time. And peep the date, if you guys can see it. If you guys can see it, that says 10/26/18, right? And then over here on the left, it says below the passing standard, below the passing standard, below the passing standard. And it was for what? Let's see. Management of care, safety, health promotions and maintenance, psychosocial integrity, basic care and comfort. Let's see. Pharmacology, below the passing standard, right? So that's what you'll get. That shit is backwards. I know it's backwards. You new here? I'm about to give you a 14th reason why. I'm just playing. I know it's backwards, but you can read. But regardless, this is what a performance breakdown will look like. Okay? So, and if you don't get one, and if you are unsuccessful on your NCLEX exam, just call your board of nursing and they'll send you one. So that way you can at least have a starting point. Okay? But shout out to everybody that just joined. We did NCLEX questions for both RNs and LPNs. You guys can go over there and check that out for yourself. Any TNCC course, online or in person, you would recommend. We have a TNCC course here. I believe they offer it online as well. But we do offer it online, but I'm not the program director and he does the different things with that. If you send me a DM, DD, I can forward you that information if you were trying to do an online course. Thank you so very much. Nazette, you're welcome. You recommend UWorld. I keep hearing that. I never recommended UWorld, so I don't know what you're hearing. I'm gonna need for you to take that out because that's not what I said. No, so UWorld, I didn't like UWorld. UWorld just did not work for me, and I used it multiple times. But UWorld can work for you. It's been around for quite some time. They have really good pass rates, but it just depends on if it worked for you. If you don't have a good understanding of content, I wouldn't recommend it. I recommend finding something that's going to give you some content as well as give you, can give you questions. So if you have a good understanding of content, cool, go ahead and get you some questions. But I'm one of those people, I'd rather have it than not need it, than need it and not have it, if that makes sense. So it says Nizzle, I was here a couple of months ago saying I was going to fail. Today I officially am a red. Look at that. Look at that, Nizzle. You coming up in here with all your negativity. And look at that. Now you're a registered nurse. So Nizzle, congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to all 105 people hanging out with us, what advice would that be? And once again, congratulations to you. By the way, ladies and gentlemen, since I do have a good amount of you here, I'm going to be doing a live with Nurse Glamour and Nurse Larissa. If you guys don't know who they are, Larissa helps nurses get into nursing school. And like myself, Nurse Glamour helps with NCLEX. She is an NCLEX strategist. All right. And so all three of us are going to be doing a live on Thursday at 7 p.m. So make sure you guys are here for that. All right. You guys can get all your questions answered. We're going to be, it's going to be a good time. It's going to be a good time. It says greatest shit show is me, but you're a close second. Oh, Ariana. You trying to be my friend? You trying to be my friend? She's trying to be my friend, y'all. Stop it. Maya says, what is the breakdown for LPN, LPN and LVN NCLEX? It's the same. It's the same as an RN, except for that instead of management of care, it's coordinated care. Remember, as an LPN, LVN, you learn the same content that an RN learns. It's just, it's your scope of practice. You need to know what you can and can't do, what you can and can't accept. You know that you can do sterile procedures like wound care, and you can do Foley catheters. You know that you can't do anything involving a central line or a PICC line. You know you can't do IM medication or IV medications, I'm sorry. You know you can't do blood transfusions. You know that you don't do initial teaching. You know that you collect data, and if something is out of range, you report it to the RN. Just like RNs, if you know if something's wild and out of range, you implement the ongoing assessments, and if it's not going well, you call the doctor. You see what I'm saying? That's how it goes. All right. I'm going to hang out here for about another 2 or 3 minutes. What other questions do you guys have? Like I said, if you guys are new here, welcome. Did NCLEX questions. We do them Monday, Wednesday, Friday, 5:30 Central Standard Time, because I live in Texas. Somebody asked me what school I went to. I went to Texas A&M in Corpus Christi. I was going to go to UT, but they were playing too many games. So, and by the way, it doesn't matter what school you go to, as long as your school is accredited. All right. As long as your school is accredited, that's where you want to go. Maya, you are welcome. I failed 2 times. I was so disappointed in myself, but I know what my dream and passion is, and I'm ready. Hey, look, that's the shit that I like to hear. But here's what I will tell you is you got to put in that work to turn that dream into a reality. Just saying. But I know you'll get there for sure. What percentage do you need to pass the NCLEX? You need to be above 50%, but you'll never know what that is. Essentially, you need to be above 50%. That's what it is. Community college for the win. Straight up. I did all my prereqs at a community college, and then I went to a university to get my BSN. And I didn't even know at that point that you could get an associate's degree as a nurse. Didn't know that. If I would have known that, I would have been a nurse 2 years earlier than I would have been. So you take your NCLEX on Wednesday. Shout out to you. So I expect for you to be here on Wednesday and let us know how it went. Junior college over here. Shout out to you, Gabby. Hey, I ain't mad at you. I ain't mad at you. Like I said, as long as your school is accredited, because the last thing that you want to do is to go to a school and they're waiting on their accreditation and you're there and you get 90% of the way and they're just like, oh, well, sorry, they don't got accreditation. So all that time, all that money and all that time, which you can't get back. Money, fuck it. You can get that back. But time that you wasted, So y'all need to stop being so fucking desperate to try to get into a nursing school if they're not accredited. I don't want to hear nobody say anything about going to a nursing school saying like, hey, they're working on their accreditation. No. You better go. You better go to a school that already has that stuff in stone and leave it alone. All right. For accreditation, should I really rely on what the school website shows there or elsewhere? If you ever want to know if a school is accredited, go to that state's Board of Nursing and it will show you their accreditation status. It'll say under review. It'll say accredited or, along the lines of that. Okay. So anytime I'm looking for a school, I'm going to the Board of Nursing and I'm just like, oh, let me go and look. Oh, okay. It's under review. I wouldn't even go there because it could be under review for years, and the next thing you know, you'll get it's like you're kind of playing with fire because you don't know. You really don't know. Hey, shout out to everybody that just now rocking. We did NCLEX questions. And essentially, I'm kind of answering questions. I think I got to all the questions, like the Florida nurses, exactly. But the Florida nurses weren't the only ones, where these schools, they pop up out of nowhere. They were happening in Alabama too. They're happening a lot in California right now, where it's like $150 to $200,000 for you to go to like a 2-year private school. And you're better off leaving the state to go somewhere else to an accredited school. I'm just saying. All right, ladies and gentlemen, I have reached my peak for tonight. I appreciate everybody that came here and rocked with me and did the NCLEX questions. I appreciate everybody being here. Last little plug. Make sure you guys check out everything I have going on in my link tree. If you guys are looking for coaching, I got an NCLEX coaching and mentoring that I do where we do one-on-ones. 7-day NCLEX course. Right now, you can join the program for $7. I have 2 NCLEX reviews in there. 2. One based off of the NCLEX test plan, and the other one is the next generation NCLEX review, where I go over 100 questions, right? And that in itself is 4 hours long. We love you too. I love you, Samantha. I appreciate you. You're a frequent flyer and you're always here. So Geraldine, same. But make sure you guys go over there and check that out. I got an ebook you guys can check out. And of course, there's that free download that's over there as well. Check me out on YouTube because all of these lives eventually will end up on YouTube. But yeah, got 65 videos over there in the 7-day NCLEX course. So you guys can go over there and check that out for yourself. But I hope everybody stays safe. I want to see everybody back here on Wednesday. It says, thank you. About to go to your site now. I appreciate you, Lizette. Eliza, I appreciate you. And I will see everybody on Wednesday.